Let me take you back when you were born. When a baby is born, how soon after they are born, they get testing for vision and hearing. Very early on, right? You do not get testing for taste and smell, ever, unless some point you present to a doctor, and it's likely you're at a specialist at that point where you've pursued a problem because you've noticed that you have a smell or taste dysfunction. But otherwise, we do not have routine testing, and there needs to be, because there's congenital conditions where you can have a lack of smell or taste. Those congenital conditions can be indicators of other developmental disorders. But also, as we age, our sense of smell and taste change. We've now learned, and there's evidence, that a loss of smell or taste can be an indicator to other illnesses, such as Parkinson's, Alzheimer's, and other dementias.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Pamela Silberman, co-founder, board member, and treasurer at the Smell and Taste Association of North America, or STANA. Pamela, welcome to the show.
Thank you. Thank you for having me. Really appreciate the opportunity to talk with you. I love your podcast, and so it's a great opportunity to be here. So we appreciate the interest and the focus on our work.
Well, that's a great intro. Tell us about STANA, and thanks for listening.
So the Smell and Taste Association of North America is the first patient organization to focus on people who suffer from smell or taste dysfunction in the United States and Canada and Mexico. And our work is to provide education, advocacy, awareness, and collaboration with clinicians and researchers studying smell and taste.
Pamela, I had a roommate in grad school who didn't have a sense of smell. And so you're devoted to smell and taste disorders. It's a disorder, not a disease. What are smell and taste disorders?
So there are a variety of causes that could create smell and taste dysfunction. In some cases, it could be disease-related, and in some cases, it is a disorder. So you mentioned your roommate, who sounds like may have been born without the sense of smell, and that is a rare condition. It's called congenital anosmia. But other people who over the course of their life might experience dysfunction, there's a variety of causes that could have led to that. For example, it could be an infection. It could be allergies from inflammation in the nose. Traumatic brain injuries can lead to smell or taste dysfunction. Sinus infections, nasal polyps, and really aging. Over the course of our life, our smell and taste begin to change. There's really a wide variety of causes, and there's still a lot to learn about the underlying mechanisms of smell and taste.
Pamela, is this common? How many people are affected? Do we even know?
What we know about the population is that the estimates are that there's over 13 million people over the age of 40 that have smell dysfunction. And 1 in 4 Americans over the age of 40 will experience an altered sense of smell. And on the taste side, there's at least 20 million people that have issues with their taste. But this data is almost 14 years old. And something we've done is tried to advocate for more accurate information about people suffering from smell and taste disorders, especially given the recent experience of the COVID pandemic, and that we now have millions of additional people who are living with smell and taste dysfunction due to COVID. So our numbers are not accurate, but we know there are millions and millions of people in our country that are suffering from this. And I just wanted to bring your listeners in and bring anybody who's now thinking about this topic that they haven't thought about before. I just want to take you back to how your day started today and how you're sort of laying in bed first thing in the morning, your alarm goes off, you don't want to wake up, you don't want to get out of bed, but that smell of coffee from someplace in the house has now inspired you to get out of bed, to shuffle down to the kitchen. Your instinct's probably to reach into the refrigerator and grab that milk or cream, give it a whiff, make sure it smells okay, throw it into your coffee, and then take your big gulp of coffee, and that aroma passing your nose and the flavor of the coffee over your tongue is the jolt of energy you need to start your day. And for millions of people like me, that's not something we experience every day. That's not the way our world works. We cannot enjoy things through smell or taste due to our dysfunctions.
Wow. Well, Pamela, let's turn to your journey, because you're a co-founder of STANA, and you just revealed something, that wonderful ability to be able to have that cup of coffee in the morning and really sense the flavor. That's not something that you have. So talk to us about the origin, I guess, of STANA and how you came to found it.
So in 2008, I had a sinus infection. I went and sought help from an otolaryngologist, the ear, nose, and throat doctor, and he prescribed antibiotics. And as I was recovering and the symptoms of the sinus infection were starting to dissipate, I realized I couldn't smell. Now, most people have had a cold or a sinus infection. You've had that experience. Like some point in your dealing with the condition, you've noticed, I don't smell very well. And that usually recovers when the infection goes away. In my case, it didn't. The ENT then referred me to a taste and smell clinic in my area, and I started my journey of trying to recover my sense of smell. I was not given much information as to why my smell didn't recover. Quite frankly, back in 2008, there was even less information than there is today, and a lack of understanding around it. But this smell and taste clinic was trying to look a little more deeply at the mechanisms around smell and taste and try to treat it. There are really no treatments and no known cures. They attempted to use steroids, and these were steroids, as a way to possibly sort of jolt my smell back, but it didn't work. And I spent a lot of time and effort and money with them because it was not covered by insurance. I didn't get a result, didn't get my sense of smell back. I continued to pursue finding answers and went off to another smell and taste clinic at the University of Pennsylvania, where they really confirmed that I had permanently lost my sense of smell. For me, ear, nose, and throat disorders, conditions, were actually a part of my life long before I lost my sense of smell, because my father was an otolaryngologist. He was an ENT doctor. And growing up in my household, talking about ear, nose, and throat issues were a big part of our daily life. It was certainly part of our dinner conversation. And he made sure that his children all, myself and my siblings, all worked in his practice. His hope was that we would become doctors and follow in his path. But I worked in his office in high school and in college. I did not pursue medicine. But working that closely with him and his partners and with the patients, it gave me an early appreciation for patient care, empathy for patients, an interesting insight into ear, nose, and throat conditions. And I remembered even back then that I knew people could lose their sense of smell, but it didn't stick with me that some of those people didn't regain their sense of smell or taste. And it was something he was interested in. He was a very empathetic doctor, a great bedside manner, and he was really interested in innovation and actually designed some medical devices that today are used in daily practice. But he passed away before I lost my sense of smell. So he would have been somebody that would have been my advocate along my journey. So I was really on my own trying to find my way. And it really became a very lonely experience. I didn't know other people that had lost their sense of smell, and there were limited resources to go to. I ultimately found an institute in Philadelphia, the Monell Center, that exclusively focuses on chemosensory research. And that was an organization that I started to follow. And it was through Monell that really ended up leading to my path to the creation of the Smell and Taste Association.
Pamela, I got two questions for you. It's one thing to be a patient with a taste and smell disorder, and another to say, I'm going to start a nonprofit. So what led to that journey? Because that's a lot of work. This is a part-time gig for you, all volunteer, and you got other jobs. So talk to us about that journey. Why did you decide that an organization needed to be created?
I think it was a combination of two things. One, my growing frustration of a lack of information about smell and taste disorders and really no treatments, cures, diagnostic protocols around smell and taste disorders. And that was from my personal journey. And then a bit of carrying forward of my father's legacy, where he dedicated his life to working with patients with ear, nose, and throat issues and an appreciation for the empathy of patients. So I thought I could make a difference in stepping forward and working with others to help in the creation of STANA.
Now, Pamela, your LinkedIn profile says you're a co-founder. So do you have partners in this endeavor? How did that happen?
So the idea for a patient advocacy organization in the US really came out of a conference of researchers and clinicians who were meeting to identify treatments for smell and taste disorders. And they wrote a white paper after the conference identifying where they saw gaps and opportunities. And one of the big gaps they identified was there was no patient group in the US. So no organization that they could go to access the patient community, no organization that could advocate on behalf of patients. And that's where the idea came from. And it was really a group of researchers that invited a group of patients to all sit down together and start talking about this idea of a patient group. And we started meeting on a regular basis. It was clinicians, researchers, and patients meeting together virtually for several months, coming up with this idea around forming this organization. And that really took us into early 2020. And in March of 2020, we started to hear from researchers in the UK who were following COVID, but following symptoms of COVID, that there was true evidence coming out that early indicators of COVID were smell and taste dysfunction. And it created a sense of urgency. We had to get this thing stood up and put together pretty quickly because we were realizing as the pandemic was unfolding, and smell and taste was an early indicator, we knew that we were going to have millions of people who were going to add to our patient population who we needed to serve.
Wow. Well, let's turn to STANA. So the pandemic is just starting and you're hearing about people losing their sense of taste and smell. What did you do? What was the action plan?
We teamed up with a group of researchers and we were able to get funding to look at the impact of COVID on patients' lives, in particular people who were experiencing smell and taste loss. And one of the things that STANA helped administer was a survey of patients. So as we were preparing this survey, as patients on the panel and working on this together, we asked the researchers, what kind of turnout would you anticipate? And they said, oh gosh, if we got like 300 people to respond to a survey, that'd be really great. And we were like, 300 people? We were reading Facebook pages and individual posts and other social media posts where people were very upset about losing their smell and taste. There was a lack of information. They didn't know where to go for help. And we could sense that frustration. And we said, oh my gosh, you're going to get many, many more. And in fact, one of our co-founders, who's now president of the organization, Katie Boateng, said, I think you're going to get over 5,000 responses. And they thought that was an unbelievable number. That's not what you get for these surveys. So we put together this survey. It was 60 questions long, 15 minutes long to take. And in fact, we did get over 5,500 responses. We have an incredible, rich data set of information that these patients provided to us. We got responses from people in all 50 states. It was a diverse audience of all ages and different conditions and different experiences across the smell and taste dysfunction. And so that has been an incredible resource. We then worked with the researchers and clinicians on this project, wrote a white paper about what we learned. We were a co-author on that and put that out soon after we completed our survey. So that's one of the things we've done.
Are you a membership organization? Can I join? Can I donate? What can I do?
We are not a membership organization, although we maintain a mailing list and we put out a quarterly newsletter of information and updates that people like to follow. But really how we are funded is through donations, grants, and contracts.
I see. So the pandemic has waned. We still get COVID, but it doesn't make headlines anymore. So what is STANA doing today? What kind of initiatives are you working on?
One of the things that we learned from this experience was that there is definitely a need and a role for patients to be at the center of these conversations, and really these conversations around chemosensory research. So one of our priorities first is really to be a support for patients who are living with these conditions, providing them with education, information, engaging programming, and a community. It is incredible when we get people together, and often it's in virtual situations, but the fact that you can share a lived experience with somebody else who's gone through that is so impactful, because it is very lonely. This can affect your mental health, your nutrition. And so to have other people that you can share that experience with, often family members who are not going through it can't appreciate it. Things like your food and your beverages can just taste like nothing, and your sort of zest for life can really go away. So having a community of people that you can share those experiences with is really important. That's something that we're doing. Improving patient care is at the forefront. One of the things is that there is no routine testing when it comes to smell and taste. So what that means is if you're not tested, then somebody doesn't know you have a problem.
So I go to my doctor's office for my annual physical, and you're right. She didn't ask about my sense of taste or smell. That's what you're talking about.
Yeah. So let me take you back when you were born. When a baby is born, how soon after they are born, they get testing for vision and hearing.
Right.
Very early on, right? You do not get testing for taste and smell ever, unless some point you present to a doctor, and it's likely you're at a specialist at that point where you've pursued a problem because you've noticed that you have a smell or taste dysfunction. But otherwise, we do not have routine testing. And there needs to be, because there's congenital conditions where you could have a lack of smell or taste. Those congenital conditions can be indicators of other developmental disorders. But also, as we age, our sense of smell and taste change.
And why is this important to track?
Well, in particular, we've now learned, and there's evidence, that a loss of smell or taste can be an indicator to other illnesses, such as Parkinson's, Alzheimer's, and other dementias.
Wow.
Without routine testing, we don't know that somebody's, experiencing this. It could be a symptom, it could be part of a condition, but also we don't have good numbers to know how many people are affected. I mentioned numbers earlier, but they are a bit out of date, and it's not something that we're regularly testing. And if you haven't been tested and somebody hasn't acknowledged, like in my case, lack of a sense of smell, I have anosmia, you don't get an official diagnosis, and it's not in your medical record. So these are all types of things that we need to address and fix. And so the first thing we're advocating for is routine and universal testing. And then the last thing that I would mention that's really an area of focus is patient-centered research. There is not much research in the way of smell and taste. It is underfunded relative to our other senses.
And is that because researchers think it's not life-threatening, it's not worth researching, given all the other priorities?
I think in our society, there's a general underappreciation for smell and taste. People do not see it as important as hearing and vision. And so it is just really the underappreciated senses. And that's kind of like a societal thing. Because we know no researchers who spend their lives focusing on smell and taste. But,
Right.
When we look at the federal funding, for example, hearing and balance get 58% of the federal funding, and vision, speech, and language get 30%, and smell and taste is 12%. And there's just hardly any clinical trials around smell and taste. So something that we are working on is advocating for more funding, increased focus on smell and taste, but importantly, involving the patients in the process. And so we are training patients to be prepared to act as research partners. So not just subjects, but research partners. So they're on the team from the beginning of the research process, the design of the research, all the way through the entire sort of lifespan of a research project to ultimately findings and co-authoring results. And we think that that will lead to research that is more focused and aligned with the priorities and issues that patients face every day and lead to, hopefully one day, treatments and cures.
I want to wind back to something that you said. You said that a lack of taste or smell can become a mental health issue. Talk to us about that. That's provocative.
Yeah. So the lack of smell and taste, first of all, becomes a very isolating experience. People can be impacted and feel like they don't want to be in social settings. You don't personally know how your person smells or your clothes smell or how an environment that you go into smells. And so it can be isolating from that standpoint. Never having those senses or losing those senses can really have an impact on your outlook. It can affect your eating and your enjoyment of food. And so all of these things start to pull together and weigh on you. And then it can have a cascading effect and affect nutrition.
Wow. Because I remember during the pandemic, my husband, when he got COVID, lost his sense of taste and he just didn't want to eat. He said everything tasted like cardboard. And I thought, oh, dear God, like, please let not this be permanent, because he was losing weight fast.
Yeah. And it's sort of our support effort with patients. We will have sessions and talk about cooking and nutrition. People can often retain their taste, which was the ability to detect bitter, sour, sweet, salty, and umami. But what they lose often is flavor, which is the combination of your ability to smell combined with that taste. And when you lose flavor in particular, you really can lose a lot of interest in food. And so we'll have sessions with patients talking about how bringing in texture can make things a lot more interesting. What your food looks like can help make the excitement around food and eating, and spices. And so we'll try to talk about those ways to accommodate a lack of smell or taste and how that can impact your eating and your nutrition. When we go back to our survey and we asked people what aspect of their quality of life, certainly food, nutrition, eating, cooking, those were the things most affected that were routinely reported to us.
Pamela, I'll refer the listeners to your website, which we'll put a link to in the show notes, because there are some terrific patient resources as well as links to clinics and podcasts, et cetera. For my listeners that run nonprofits and they're trying to raise awareness of what they're doing, what are you doing to raise awareness? Because this sounds like a big problem, but an underappreciated one and an underreported one potentially. So how are you getting the word out?
Yeah. We sort of look at our target audience. By all means, it's patients and, sort of patient first, patient-led organizations. So we think about them. And we have found that via our newsletter, but also via social media, Facebook pages, there's a significant amount of activity on Facebook, are ways that we get to the patient audience. We offer them our newsletter, we offer them programming and community. We very importantly align with researchers and clinicians. They are a big part of our ability to succeed in what we do. And so we work closely with them in a variety of ways, including preparing a cohort of patients to partner with them. But also we are showing up and participating in conferences. Next month we'll be at ACAM, which is the Association of Chemosensory Scientists. We'll be there working and talking with researchers, and again, also with clinicians. And we've just hired an outreach director to help us really promote these partnerships and these relationships and find ways to work together.
Pamela, in 2026, what do you want people to know about taste and smell disorders?
So one of the byproducts of COVID is that there's more attention and more awareness around smell and taste disorders. So we are certainly focused on that and taking from that momentum to continue the focus. We're working closely. The NIH launched in 2024 a National Smell and Taste Center. We're sitting on the advisory board and working closely with that team. We sit on the Science and Medical Advisory Board of the Monell Institute. And so any way that we can work with researchers and clinicians, we're doing so. We are partnering with other patient organizations. This is a really important part of our future growth, where smell and taste comes into play. For example, we teamed on awareness campaign with the Michael J. Fox Foundation last year to bring awareness around smell loss being an early indicator of Parkinson's. We hope to do that with more and more patient organizations where smell and taste loss are a factor, because we really do not want people to overlook dysfunction in smell and taste and what that can mean, and that it can be an indicator of other conditions, that it really should be seen as a public health risk and given the attention that's due. We're also hoping to team with partners in industry. For example, there's a real safety factor here with people who have smell and taste loss, as people with smell loss cannot detect a gas leak or spoiled food or smoke from a fire. So any organization that we can partner with to bring resources to patients or build awareness around the impact of these disorders, we're looking to do.
Pamela, there's an important day coming up in April. Tell us about it.
April 24th is National Sense of Smell Day. It is an awareness day where we really call to our community and beyond our community for people to think about their sense of smell. It's really a day for people who have their sense of smell, and just we want you to take a moment and appreciate it. And then think about people who, are living without a sense of smell and what that might entail. And so it's a really important day for our community, but really to bring awareness around the sense of smell.
Pamela, I've certainly learned a lot from this interview. Thank you so much for being on the podcast. You'll have to come back and tell us about all the great things that you're doing, and hopefully you'll have better numbers.
Yes, we're advocating for that too. So I would love to come back with more accurate numbers. Thank you so much. I really appreciate it.
Thanks for listening to Associations Thrive. We're so glad to have you here. My personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends.